Hello, I'm Tiffany Hensley McVeigh, a Scientific Director at Clinical Care Options. Before I begin, I'd like to thank the conference organizers for the opportunity to present our findings on behalf of my colleagues. So patient variables that inform HBV treatment candidacy and treatment selection are complex and interconnected. To aid healthcare practitioners in aligning management decisions with practice guidance, we developed a web and app-based decision support tool. You can see in the center of the poster under Section 4 the workflow of the tool. The tool enables users to specify a guideline, AASLD, EASL, or APASL, and prompts them to enter patient variables including HBe antigen status, HBV DNA and ALT levels, and liver inflammation and fibrosis, among others. Users then select their intended approach for the case, after which the tool displays guideline recommendations specific to that case. In this analysis, cases entered from March 2019 through November 2020 by users who specified APASL guidance were assessed. Under Section 2, you can see that more than 20,000 cases were entered into the tool, of which 3,511 specified APASL guidelines. Of authenticated users who entered cases, a majority, 73%, were from the Asia-Oceania region, and 74% of cases were entered by physicians. Of the total cases in which the user selected the APASL guidelines, 2,416 reached a clear guideline recommendation, and of those, 1,721 cases were entered by users self-identified as healthcare practitioners. Of note, 58% of cases in which the user specified were identified as being real patients versus hypothetical cases. You can see on the bottom left that about 60% of cases entered were HBe antigen negative cases, and both high and low HBV DNA levels were represented. Focusing on the data on the right, we begin by looking at the total cases for which the APASL guidelines were selected. Of those, almost 69% reached a recommendation. For the remaining 31.2% of cases, the user selected unknown for a variable necessary to reach a guideline recommendation. The information most often missing was the level of fibrosis or inflammation, which was unknown in 14% of cases. That's in the green. Below that, you can see a focused analysis on the cases entered by healthcare practitioners in which a clear recommendation was reached. Overall, the intended management approach matched the guidelines in 59% of cases. Cases in which the healthcare practitioner chose to treat when monitoring was indicated, and those in which the healthcare practitioner chose to monitor when treatment was indicated, were equally represented at 13% each. That's in the light blue and orange. For example, for cases with ALT levels between 1 and 2 times the upper limit of normal, 30% of healthcare practitioners chose to treat when monitoring was indicated. In contrast, other types of cases show a propensity to monitor when treatment is indicated. For example, in 22% of cases with moderate to severe inflammation or significant fibrosis, and in 15% of cases with compensated cirrhosis, the healthcare practitioner chose to monitor although treatment is indicated for these patients. Finally, of cases in which the healthcare practitioner's intentions were inconsistent with guidelines, 50% indicated that they plan to change their approach after being provided the recommendation by the tool. In conclusion, this tool highlights important knowledge gaps in the information needed to make appropriate HBV management decisions, such as the level of fibrosis and inflammation. It also demonstrates differences between healthcare practitioners' approaches and the APASL guideline recommendations. Finally, these results demonstrate a post-education impact of using this tool, with 50% of users indicating that the recommendation changed their management choice. Thank you very much for your time and attention.